Mr. Speaker, the government has suspended the STARS helicopter service because of a tragedy last week. In view of the now 3 critical incidents and a total of some 15 other incidents which the government says it's investigating with respect to the STARS service, it's important that the public know precisely what was in the government's contract with STARS with respect to the guarantees of high-quality service to the people of Manitoba. I ask the Premier to act today to share this information with Manitobans by tabling the untendered $100 million contract with STARS helicopter service.
Thank you, Mr. Speaker. Mr. Speaker, as you know, there is in Manitoba a unique procedure that is followed by this government, implemented by this government, called critical incident reviews. Anytime a serious situation occurs, such as we've seen here, and families are put at a tremendous disadvantage and have seen losses in their lives because of inappropriate service, a critical incident review is done. The results of that review are made public, first with the family and then with the wider healthcare system. And those critical incident reviews are used to drive improvements in the system. They are used to drive improvements in the system, and the recommendations are followed and shared publicly, and the improvements are made in the interest of best service, Mr. Speaker.
Mr. Speaker, we're talking here about what was in the government's $100 million contract with STARS service that would guarantee quality of health care delivery, because that is what is at question right now.
In a lot of trouble.
And it may be that the government doesn't ordinarily disclose commercial contracts.
Oh, yeah.
But in this case, we're dealing with a situation where there have already been unintended consequences, where people's lives have been severely impacted. The public not only has a right to see the contract, but a right to know what was in the contract with respect to guarantees of quality health care delivery. I ask the Premier, will he act today and produce the contract and table it in this legislature?
Mr. Speaker, I believe the member wants to ensure that there's good services offered to Manitobans, which is exactly why the service was brought into Manitoba first in 2009 during the flood events then, brought back in 2011 during the flood events then, and then continuity of service was provided after the 2011 flood. And any time an incident occurs, it is reviewed through a critical incident review process. Recommendations are shared with the family, improvements are made in the system. Now there's a systemic review being done of 15 cases here by a physician, a medical person outside the province of Manitoba that will take a thorough look at it, will make recommendations on what improvements need to be made in the system. And I can assure the member opposite that that is the point of having the STARS system in the first place, to have a timely response to people when they are in a position of medical crisis, whether it's a flood or otherwise. And we will continue to offer that service to Manitoba after these reviews are done, and we can be assured by medical professions, their advice will assure us that the service is being offered in a way that is appropriate and safe for the patients.
Mr. Speaker, the Premier's not listening to the question. It has to do with the contract that he has signed. The Executive Director of Health Emergency Management is saying of STARS efforts that basic medical practices and basic medical advice appears not to have been followed. Mr. Speaker, the public has a right to know the details of the contract that the government signed with STARS. But the Premier is keeping Manitobans in the dark by refusing to table this contract so that Manitobans can fully know and understand what we're getting for $100 million. I ask the Premier, should Manitoba decide to terminate the STARS contract, can the Premier at least tell us today how much it will cost Manitobans to end the untendered $100 million contract if the service is found deficient?
The focus is on patient safety, which is why the critical incident reviews are being done, and out of an abundance of caution, additional reviews are being done of patients that have been transported by the STARS system by an outside medical professional from British Columbia. Medical advice is followed in all cases with respect to how services are provided by STARS, including putting medical professionals like doctors on the planes when patients are being transported. The focus of the reviews is patient safety. The focus of the review is being done by medical professionals, including doctors with expertise in this area. And their recommendations will be followed to ensure that safety occurs, whether it's on the ground, in the air, or in an ambulance. Anywhere that safety patient transportation is being done, appropriate medical advice will be sought and followed to ensure safety for people. That's the purpose of the review. That's the focus of the review, and the results will drive improvements in the system, Mr. Speaker.